and welcome. You're watching Medically Speaking. I'm Meenakshi Preti, and with me is a doctor who needs no introduction. I'm talking about Dr. J.S. Titiyal. If you've ever Googled two words, ophthalmologist and Indian doctor, I'm sure you have come across this name. From taking care of the eyes of the biggest names like Dalai Lama or even Atal Bihari Vajpayee, he even has a Padma Shri to his kitty, but yet very humble. I would like to welcome Dr. Titiyal. Hello, sir. Thank you for joining us. And first of all, many congratulations on your new role. Tell us about how challenging it is, what really you are looking forward to changing now that you have such a big charge under you.
Thank you, Meenakshi, and namaskar to all the viewers for this lovely program of yours. Indeed, it's an honor for me to be a chief of the center.
Yes.
And you know that this center was named after the first president of India, Dr. Rajendra Prasad Center for Ophthalmic Sciences, New Delhi, a part of AIMS New Delhi for the last almost more than 5 decades. And this has been an institute basically meant to service the country, to provide the best technical help possible to entire sector of society. Apart from that, education to bring out the best talent of this country, and these talented people will serve the community in large. And third important thing is to build up our infrastructure to help Minister of Health in terms of making blindness curable, preventable, and apply the guidelines for the society. And in fact, you'll be glad to know this institute was the first institute to develop the blindness program in the country in 1976. And subsequently, various blinding programs came from the various parts of the world, and WHO, IPB, they all started blindness program after our program from the Indian nation. So we are very proud that we did help in making a blindness program. As far as challenges are concerned, chief of the center has many challenges to come across. Being a clinician myself and surgeon, that part I have handled very nicely in last 30 years, and I'll
Yes.
do subsequently also. But the challenges are basically manifolds. One is to take care of a patients in a manner which they desire in an institution like AIMS, give them
Yes.
a highest possible technical support, highest newer technologies to improve the outcomes in terms of investigation and surgery. And second important thing is to improve the space for the comfort of patient and relatives, which is so important nowadays, and make things comfortable in terms of service wise, the checking up process, giving them a final interventional treatment for these patients, and improve the outcome for these patients. Second challenge which I'm going to face is to improve the various functioning of the center in terms of making center much more approachable, much more helpful to the all sectors of a society and government also.
Yeah.
I'm looking for developing certain things which will come in future.
Right. So, but as the head of the RPI Center, and especially because it seems, I'm sure there is a huge disproportionate doctor versus patient ratio, because we see it all throughout AIMS. Because end of the day, AIMS and a very few elite institutes cater to those who cannot afford really the best medication, the best doctors of our country. How do you plan to meet that challenge, sir?
You are absolutely right, Meenakshi. There is definite disproportionate manpower in relation to giving a comfortable patient care to our patients,
Hmm.
because eye center is such a center where we get patients who are premature babies to a very old adult people. So we have a wide range of age group coming to us with different types of visual disability, and requirement of treatment is different. So we have to make a different areas for different type of people and different types of setups. And the technical support you rightly talked about, we do have a good number of faculty members, which may be largest in the country, and they
Yes.
are well trained, well equipped with the various state of the art equipments in the center. The other important issue which we are facing today across the country and institute is the ancillary manpower, that is technical support, the staff nurses, the other security people, the people who guide our patients, social guides and counselors. Those are the area which we are lacking, and we need to improve those areas. If I say one ophthalmologist would require at least 2 to 4 optometrists, technical optometrists, to support the requirement of a good treating area. So we have a definite lack of a
How do
technical
you
support, which I am going to
Okay,
look after.
that's what you plan to meet, sir. But I'm sure your challenges have become manifold considering we are in the COVID era. You have taken over at a very difficult time, sir, isn't it? Help us understand really how do you plan to ensure all these structural changes? Because the changes you talk about are manifold. From sprucing up the space, you said, to getting more technicians, making the overall environment viable, approachable, and comfortable for those who come. But is that possible considering we are in such a difficult phase, and third wave, inevitable third wave, many say is literally around the corner, sir?
Yeah, Meenakshi, that may be possible, but we know that we are never going to go back to our previous times. We can't have a same facility work for this particular challenging period of COVID. So we have already made a lot of modification, and the future modification of infrastructure would be there. There we have to make sure that we have a various stations for a patient to go through, and these stations are made in such a manner there's a definite a physical barrier or a distancing for people, and apply other resources to make things comfortable for patients, relatives, and the service providers, because all three segments has to be comfortably placed in our
Yes.
infrastructure. So we are segregating various areas: patient workup area, investigation area, and the intervention areas are segregated. But only thing is we require more time. So initially, if you say one patient in the RP center coming for a regular eye checkup would take at least 1 to 2 hours. Now that time frame has increased to almost 3 to 3.5 hours. The number of patients are going to definitely decrease to have to accommodate in that time frame. But we are looking for how to improve the timings. So we are working right from 8 o'clock morning to now almost touching 5 to 6 p.m. for OPD services also, and
But
we
so
are.
my question is, and I'm sorry I'm interrupting you here, but I want to know that as far as OPD service is concerned, and we always leave, our comments open for our viewers, and a lot of viewers, one query is coming again and again. Should we go to our OPDs? Should we get a cataract operations right away? Should we hold it considering it's COVID? What will you say to those as the chief who want to come to your center but are apprehensive of COVID?
I think no, people have to live up with this situation.
Hmm.
We have to come out of this fear in the mind that COVID is there. Only thing is you have to take a proper precaution to not to get infected yourself or to infect other people. So if you understand that if you protect yourself, you are protecting other people also. That has to be the first thinking for all of us. So first protect yourself, then protect others also. In that way, it is quite safe to come to OPD services, especially those people who are
Right.
suffering. If you have a simple problems, it's better to have a teleconsultation, which is going across for the last more than 1.5 years in AIMS. We do a lot of teleconsultation services to our people.
Okay.
In there also, if you find that these people have a serious problem which requires a definite investigation, then they are given an appointment to come to the hospital.
Hmm.
In fact, now with the decrease in number of cases, we have opened direct access to our patients also.
Yes.
Apart from the online appointment, you can have a direct access also. We make sure that every patient has a mask because we provide mask also. We have a staff to put them a social distancing also, and there are people to take them to various areas so that they don't go here and there and don't crowd. So those precautions are taken. There are sanitizer available in every corner, and doctors, staffs, they take a full precaution with a proper PPE kit. Therefore, there's no chance of cross infection. So every
Yes.
safety measures are taken for OPD. As far as surgery is concerned, people who are coming for surgery, we make sure they have a COVID negative results. So only after COVID RT-PCR negative test, they are taken to the OR and done surgery. And
Right.
if somebody has had a COVID in the past, we tell them to wait at least for a 3 months before they come for a surgery or any other serious checkup. But if
Okay.
they have a serious eye problem, then even there we have to take care of them. They don't wait at home. It's quite safe now to come out in the hospital because hospital will take the much more precaution than any other area.
All right. And sir, you spoke about a number of changes which you want to bring in the RPI Center as the chief. Tell us really what your roadmap to do the same is. What are the timelines you're looking at? What's your roadmap to achieve your goals, which you just spoke to us about, sir?
There are certain things which I have in my pipeline.
Okay.
First thing is to the working environment has changed. So we need to have a new guidelines for all types of approaches for our patient care, and in that way we are going to come out with a new guidelines for a patient coming for various checkups, various surgeries. That is for a hospital, and we are going to make a new guidelines for the country. So how to go about for these people who are living in remote places, who are living in urban areas. So those guidelines will help us to streamline all these difficult times.
Okay.
Second thing is we are looking for taking care of people coming with a blindness, especially like diabetic blindness, people coming with corneal blindness, that is being there for a long time. But I'm looking for a preventable blindness, the blindness which can be prevented at a doorstep in a grassroots. For that, we are already doing a rapid assessment of various causes of blindness, which can be preventable,
Okay.
like injuries, malnutrition,
Fine.
or people use unnecessary medicine which are not required,
Mm-hmm.
or festival injuries, tuna packet injuries. There are various things which are preventable. In fact, almost 70% or more causes of blindness can be prevented. If we can prevent those blindnesses, then we'll decrease the total number of patients who are going to go get blind subsequently.
Right.
So that is we are going to work with the government to look into ways to go into a peripheral area, that is a primary center, like district centers, to
Fine.
make those guidelines to check what is a preventable blindness, which are going to be based on some sort of a app, mobile app,
Hmm.
so which will tell us that what type of disease a person is suffering from, or what type of environment he or she is working, what type of injury or what type of damage can occur. So that can be prevented to begin with. That is one.
Okay.
Second is looking after the guidelines for children, because they are all having online teaching now, and I'm pretty sure
And
the
it all
third wave,
stuck in glued to their television screens. That's true.
yeah, if third wave comes, then this period can go longer for these kids. So
Yeah.
there's no definite guidelines for how to use their time in a online system. How much should be the period for a regular viewing the online? Should there be
Right.
a gap in between? If there should be a gap, how much should be the gap? If they have a particular problem, how should they approach? So we're going to come out with a new guidelines for online teaching for
Right.
schools.
So, guidelines, of course, for various sectors within the hospital for patients and various age groups as well, and the right dissemination of information. That sounds, of course, like a coherent goal, sir. I have literally just 2 minutes left to wrap the
Sure,
interview.
sure, sure. Yeah.
So, my last question, sir, to you, and of course, I'd like to take our viewers a little away from the RP Center as well. Dr. Titiyal, also known, of course, for doing the first live corneal surgery as well. So, corneal transplants is something I want to talk about because we're seeing a lot of unfortunate casualties also, in the second wave. Last message for people, sir, eye donors, people who are hesitant really to go ahead considering it's the COVID period. Perhaps this is the time when people should come ahead. I was reading, about how AIMS is thinking of drones. You have 17,000 plus surgeries which you've done, in the last year itself, or maybe till date. Tell us a message which you'd like to give people as you sign off, sir.
I think that's a very, very appropriate point for a social message to be given. Corneal transplant can, bring the vision back to a people who are blind because of corneal opacities. And there's a large number of people awaiting surgeries. More than 5 lakh people await surgery at a given time. And this COVID time has decreased the donations from across the world, including Delhi also. And now we have started collecting tissues, and we take a sample also, nasal swab and oral swab from the donor. And we
Yeah,
do RT-PCR testing for these donors also after their death. And if they are negative, we transplant these tissue to the awaiting patients.
right.
What I need to say is during this time also, pledging is not a difficult time. Pledge can be done online to the AIMS portal. You can pledge for a organ donation. You can pledge for an eye donation also. And if you have a death at home, you can always call us, and we can come as a pick up as a voluntary donor. We have counselors across the city. They can approach any
Yeah,
hospital, any mortuary, that and give them a lot of apart from counseling, grief counseling, we give them a message that you are going to do a good service to
absolutely.
society, and the donation will be the one of the
Total
best
thing you
donation
can do.
possible in a
Absolutely,
lifetime.
sir. So, of course, a very positive message coming from the new chief of the RPI Center, Dr. Titiyal. Many congratulations once again. As I sign off, these are two people from Uttarakhand, the anchor, and so that's something I wanted to highlight right at the end. Great achievement, sir. Many congratulations. The whole state, of course, very proud of you. Thank you. Thank you for giving the time to speaking to us.
Thank you, Meenakshi. I wish you all the
Thank you,
best.
sir.
Excuse me, what will you do with your first salary?
So I would like to present my first paycheck to my father.
I'll buy a laptop for my younger brother.
I will save some money, and with the rest I'll get an AC for my dad's room.
I'm going to start a life insurance policy. I think it's very important for my family's security.
Hello and welcome. You're watching Medically Speaking. Today we'll be talking about various aspects of the coronavirus pandemic, the third wave, the inevitable third wave. Is it already around the corner? Many say it's already here. What about vaccination for children? You all have many questions in your head. To answer all of those and more, I am joined by Dr. Rajesh Malhotra, Chief of AIMS Trauma Center. Thank you, sir, once again for joining us and taking out the time to speak to NewsX.
Thank you.
So my first question to you, as far as vaccination is concerned, in the last week, there's been a lot of noise about this booster shot. There are people who are very worried about the third wave, the susceptible, elderly, comorbid. Many are asking us, even on the news channels, and they're asking us to talk to experts like you about the need of this booster vaccine and if it overall improves their efficacy of the vaccine in case they are able to get a booster shot.
So that's a great question, Meenakshi, and I can understand the concern behind it. But let me be very clear about this. You know, when there's a pandemic, the public health aspects have to be kept over and above the individual or the limited goals. The objectives have to be more broad based and generally conducive to the overall welfare of the nation and the world in case of a pandemic. So as far as a booster dose is concerned, it's neither required at this point of time nor advisable, because ideally the booster dose should be given when the entire population has been vaccinated by 2 doses. It's not fair also to give a booster dose when the people are waiting for their first and second dose. So that's the public health aspect of it. The second is the necessity. Now, it's not an easy thing. One easy criterion is that you say somebody, say for example, who's got the solid organ transplant, kidney transplant, liver transplant, or somebody who's on immunosuppressants, or somebody whose immunity is markedly reduced. There we do need to concentrate for many reasons. One is, of course, these are the people who are at high risk for mortality. Second is that we also know that if the virus keeps on multiplying inside an immunocompromised person for a very long time, it may cause recurrent infections while persisting in the body, every time with a viral strain different from the first, second, or third infection. So people have reported infection, persistence of even more than 150, 160 days in a person who's immunocompromised. So in that sense, it is required. So I think when it's a time for us to give a booster dose, they are the people who should be prioritized rather than, age related criteria. Because, we may end up in a situation where everybody needs a booster dose
But
because
sir, will we see, I'm sorry, I'm interrupting you here. Will we see a booster dose in India as well? Because it is quite eagerly awaited.
yeah, so we might eventually decide about giving a booster dose because we know that, certain vaccines like mRNA, for instance, we know that their immunity produced by them wanes with time, right? And they have also not shown to be very greatly effective against the Delta variant. That's why you are having such a big outbreak in US where predominantly only mRNA vaccine has been given. So there are certain justifications for believing that we might need a booster dose even for everybody eventually, because it's a new disease and it's a new vaccine. We have to know for sure how long the immunity lasts after 2 doses. That we'll come to know most practically by the breakthrough infections, right? There's no other way to know. There's no way in the entire population we estimate the antibody and the T cell immunity to make sure that we are immune or we are not. So if the breakthrough infections start rising, we may be constrained to give a booster dose to everybody, even those who have received 2 shots earlier.
But so my question, and it's a follow-up question, and I'm sorry I'm interrupting you because as you speak, more questions are coming to my mind. You speak of a possibility or an eventuality of about everyone getting a booster dose. Will that act against various mutations, if at all we see them, of COVID in the future as well?
That's a difficult question to answer because that needs me to know what the next variant will be like. So we can only know about the variants which are in existence. I can't tell you about the next variant, and I tell you, not every variant is necessarily more lethal or more dangerous than the previous one. And some of them are not even compatible with survival. So the virus may itself mutate into a form which may just die and may not even survive. But what is very sure is that for another surge or a wave to come, that virus strain has to be significantly better in its own term than Delta variant. See, the Delta is so much better than the D614G in terms of infectivity, airborne transmission, the viral load in a person, breakthrough infection, ability to beat the vaccine. So the next one will have to be that far better than Delta because it's a survival of the fittest. The Delta won't
better, and that, of course, is giving palpitations to everyone. But I'm sure it's stronger, sir. But we speak of vaccination, sir, and I want to take this forward. Today is a landmark day for India. 1 crore people vaccinated. WHO has also congratulated us. Of course, many congratulations to you all, the entire country, especially the medical community. But the question is, India's population is large. The government's goal was to vaccinate the entire population, including, of course, the rural population by the end of the year. That seems quite difficult. When do you see, or what is your assessment of it practically happening?
So this is a great step forward in that direction only. The thing is, one, that everybody has been saying that we have to vaccinate 1 crore people a day in order to vaccinate everybody by December. Now that it has happened, why the doubt? I mean, it's your own calculation till yesterday or day before or last week. I think it's a great step and everybody needs to be congratulated. And second thing is, if whatever better from the point of view of virus or worse from our point of view, if a worse or a more lethal strain is to come, the rapid vaccination is one big hurdle it will face. Because longer we take, the longer it persists in the community, the longer it multiplies, the longer it is given opportunity to multiply by, disregard of physical distancing and other norms, the more are the chances of a worse or a more lethal strain or it's actually, we may not call it better or worse. Let's call it an upgraded version like we have a software. So an upgraded version, like of any other software, an upgraded version has to be significantly significantly more potent and has more attributes, so that it can displace the previous one. So that way, I don't think that, and I'm hoping, maybe it's a wishful thinking, that we will not have that much worse variant than a Delta variant so soon.
Yes, so but at the same time, the number of cases are also on the rise while we're getting vaccinated as well. Today itself, there are over 46,000 cases. The actual number is 46,729 cases, which have been reported within 24 hours. Kerala really is one state where we are seeing a huge surge. Onam, many say, is one of the reasons. As we are reaching the end of this discussion, sir, this is festive season. We have Janmashtami. I think on the Sunday, Monday, 29, 30, and many other festivals coming up. Do you think that infections could rise? And any advice as you sign off for the people?
Yeah, absolutely. See, the basic rules of the game have not changed. So anytime when a lot of people get together, whether leave alone the cause, whatever the cause, if the people get together, they are going to abet the spread of the infection. And second thing is, all said and done, our vaccines have got one inherent disadvantage. They have not been proven to be extremely effective at preventing the spread.
Yeah.
So, we have to have, eventually we should have vaccines which cause local immunity, say in the nose, so that the virus cannot get a foothold in your body. The virus is getting a foothold, and after that it's being neutralized by the body immunity against severe infection, ICU admission, ventilator, death. But if the vaccines are designed which can boost local immunity and avoid the virus getting into your body, will be a far, far better intervention in terms of restricting the spread. So yes, the social distancing, the physical distancing, the mask, and the everything has to be followed, whatever the festival, because I think there's no bigger religion than trying to look after your countrymen, look after the society, and think about safety of the everyone else around you, society and the country.
And so, that was going to be my last question. But quickly, I want to ask you one more question, because you speak about really when people gather, the chances of infection are higher. Now we are seeing almost every state reopening schools. What's your, what do you think about the same? There is a body of doctors, about 50 of them, who've written to the government questioning this move. Yes, academics is suffering, but at the same time, children could be carriers, even though their personal immunity may be high. What do you think? Should schools be reopened or not?
So it is something, this is an area which should be treated very cautiously, because we have examples where and don't take me wrong, I'm not saying they shouldn't be open, but we have seen that in UK, USA, when the schools were open, there was a surge in cases, mainly because children don't comply with masks. Children don't comply with social distancing. Children rapidly spread infection among themselves. Look at measles. Measles causes such rapid infection that the whole class gets infected. And the Delta variant has had that R0, which is so high. So that is why I think the constant watch has to be kept, number one. Number two, one must make sure that the entire school staff is vaccinated. So those who are refusing to get vaccinated should be kept away from classrooms. Number three, the classes can be held in the outdoors, wherever it is possible. Distance has to be maintained like it is being planned, 50% people only coming. But I think it is very important that the families who are sending children to the school are very cautious about the fact that the elderly at the home are kept away from these children for some time, at least initially. And I think we have to have a constant guarded approach, keep a watch on what is happening, and be ready to change our approach in case we think that it is causing localized outbreaks.
All right. Thank you, sir. These were, of course, some great tips ahead of the festival season. And at the same time, when schools are reopening, I hope viewers, you keep them in mind. Mostly, of course, try to stay home, stay safe. Thank you, sir, for joining us, of course, with your suggestions and your perspective on vaccination for COVID-19.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.